the Americans are doing very badly. There's no doubt. They're dying in their thousands. Brazilians are not doing well at all. What is the sense? How important is government in dealing with a pandemic such as we have? Do you have an opinion? Is that too hard a question for you, Prof?
About how important government is?
Yes, because yes.
Yeah, I think government is central in dealing with pandemics. In fact, you are seeing globally that the role of WHO has been magnified, and everybody is now seeing WHO for what it is. And I think WHO as the body, like a confederation of world ministries of health, is demonstrating what governments should do. And governments would have to, they're in charge of policy. They're the only ones who are able to control when people move and where they go. They're the only ones who are capable of actually taking these medical recommendations and making them into law. Nobody else can do this. And so government is central in any pandemic response. And in a pandemic, government must work with other governments in order to be able to effectively deal with a pandemic of this nature. Because as we are learning with COVID-19, a problem in Wuhan in China affects my grandmother in Huisero. And so it's a global thing. Governments are central in the response. The rest of us would be working to support what government is trying to do in order to control the pandemic.
Oh, thank you, Prof.
1 minute.
Okay, good. All right, I can see it. Thank you.
Matthew.
Yeah, fine. All is back to normal.
Thank you so much for your patience, and thank you for this opportunity. When we were putting this together as a ministry and trying to share our perspective when it comes to demystifying COVID-19 testing, I think these pictures are quite memorable to everyone in the panel and perhaps in the audience as well. We have the lady who's become the poster child for why you should go for testing, or perhaps the negative why you shouldn't go for testing is a lady here in red, and I think this featured in our dailies prominently. And you can see the two pictures below there. The Ministry of Health undertook some targeted testing across the different villages and marketplaces, and Kenyans were really, really, really afraid. Now, this becomes more personal when I myself, as a frontline healthcare worker, engaging particularly with the teams in Bagathi and Kenyatta, actually underwent testing myself. And I must say, even after having been taught how to collect swabs by Dr. Njenga here and supervised by Atoli here, it was still a challenge for me to sit still and have the nasopharyngeal swab go all the way to the back of my nose. And so this is something really that as government and as policymakers and people who are intervening need to appreciate, that the issue of stigma cuts across not just the general public, but also to health practitioners who are practicing and to literally everyone who is a citizen. Now, in this slide, we are trying to demonstrate exactly how the COVID-19 response has been structured. And this becomes important even as we discuss the stigma issue today, to truly understand that perhaps was there a need to restructure the way we set ourselves together in terms of this response. As you're all aware, the president, through an executive directive, was able to put together the National Emergency Response Committee. And in this committee, we have our Cabinet Secretary for Health, Mutahi Kagwe, chairing this committee. And really the principles and the guiding tenets of this committee is that it is multi-sectoral. We have participation of the Ministry of Defense, Ministry of Transport, ICT, MOH, Education, and numerous other ministries and state departments who are all involved in the COVID-19 response. And it's interesting that today we should be discussing stigma and issues that touch on mental health and anxieties, just because in the past 3 weeks, the National Emergency Response Committee has been able to direct the formation of a subcommittee within it that particularly addresses the issues of mental health, and that also addresses the issues of stigma, and also that addresses communication when it comes to gender and being able to actually have proper communication and supportive communication to our caregivers. And so again, just a testament to really the need for government to respond to this issue. We do have the technical task force, and this is the implementing team for the COVID-19 response. And this team again has adopted what now we're calling a whole of society approach. There's heavy participation and collaboration from all state and non-state actors, and it has been again a very interesting experience to be part of the frontline teams working here. And I'll touch primarily on the communications sub committee, and this is a committee that churns out all the messaging and all the communication efforts that's been going and putting forth to the public. And one, just to appreciate the media. I'm glad that Joe is here, and all the media practitioners who might have tuned in, because really at the beginning of the coronavirus pandemic, a lot of our support was really pro bono through different media houses coming together and customizing our messages with us and trying to ensure that the message got to wananchi. The communications team, has different working teams beneath it, and there is a team that really defines what we call content, and this is a team that sort of has a radar in terms of what is going on, what are Kenyans understanding when it comes to COVID-19. Are our messages actually adapted to what is happening, and are they responding to the Kenyan needs? And so it's interesting to note that at some point, and I think Joe shared that picture, where we had the burial, the CIA burial, perhaps if I can, quote the infamous burial. And I do remember this team was very quick to, one, recognize that perhaps we had failed in communicating, to the public when it comes to burial practices. What is the best way of doing it? Why did we have to sort of take the measures that were taken in terms of, putting in place very stringent conditions of the numbers of people who should be in a funeral and how we should be able to handle the deceased? And so really, it's been what I would say a learning journey. It's been unfamiliar territories, but really, lots of lessons learned, especially for the next, should I say, response that will be needed. The other committees that you see there are all quite essential. When we look at the Emergency Operations Center, beneath that is a vibrant call center, and it's important to mention it at this point. We do have our 719 COVID-19 line, and it's nested in the EOC center. And so when any Kenyan calls in, the calls get to 719 and they're redirected to the EOC center, which then deploys teams. And these teams are the ones that are able to go and, do the testing and collect samples, do the contact tracing, and ensure that we are actually mounting a response. And the rest of the committees, just because of time, and I know we're a little bit late, are all involved part and parcel of the COVID-19 response. An interesting one that I think I should point out to, because this did emerge when it came to stigma, and I've seen that Prof. Atwoli has mentioned it, when it came to quarantine. The facility preparedness team is the team that was working to look at our quarantine centers to ensure that the quarantine centers, one, are suitable, and to ensure that even those Kenyans who may have to undergo mandatory quarantine are able to understand the reason why that is a public health intervention and not an intervention that is on enforcement. And of course, how they'd be taken care of through the quarantine period of stay. And so this is how we've organized our structure. And I think as we continue, I'll be able to sort of, make reference to this, but in terms of the coronavirus response. This is a representation of the emerging epidemic curve in the country with regards to our positive cases. And what was important here is to really highlight, that each intervention was actually associated with both intended and unintended consequences in the public. If I can remember to the point of where we were able to put a ban on international flights, we actually, after making that pronouncement and setting up quarantine facilities, there was a clear change in terms of behavior change for incoming flights. I'm sure you'd all understand we kept on receiving lots of requests, one, for people fearing, mandatory quarantine facilities, and two, people trying to get out of mandatory quarantine facilities. And then, of course, the numerous complaints that emerged, and those are valid complaints with regards to how we were managing our quarantine facilities. Again, if you look at elements that deal with testing of persons, which was, initially initiated in the quarantine facilities and then over to the population, you can always see at every intervention, at every point where there was actually an intervention, there was a consequence and an effect in terms of behavior in the community. And some of the interventions that were put in play, perhaps in hindsight, and hindsight is always 2020, required some form of should I say, community entry for the public to be able to understand the rationale of some of these measures. And this includes curfew, setting up the curfew times and the idea that people needed to get home before the curfew hours. And then, of course, the really, how do I say, the effects in terms of trying to enforce curfew by our disciplined forces, and what that had in effect in terms of stigma, in terms of mental health issues, and even in terms of fear and understanding of what exactly the government was trying to do in terms of protecting its citizenry. So all those interventions have been very key, and we've noticed have had a cause and effect in terms of how behavior has been affected. One of the key strategies, as I think, and this was Joe who put it in place, saying that by virtue of the disease that we're dealing with, the invisible enemy that we're dealing with, all the therapeutic measures really are all about our society and our cultural norms and how we are as a people. And it was interesting to see that when we had different measures in terms of social distancing, closing of learning institutions, a measure that may appear mundane and simple has actually had dire repercussions when it comes to mental health. And I'll share particularly a story of different, students who are in different universities who are actually making calls to the ministry, making calls to myself, different students who are in internship programs who actually required some intervention when it comes to mental and psychosocial support, because they were wondering, yes, we know this is COVID-19, and this is in particular to the medical students. They know it's COVID-19, they know these measures are important, but these students were actually lamenting about being away, from the learning institutions and, talking about their futures and how this affects, their career progression. And so it's important to note really, and as government, we do appreciate that each and every intervention actually had an effect in terms of how it's perceived. And of course, the effects in terms of, social constraints and economic constraints that have been put in place. We did look at, the idea of public events and gatherings. Again, another important element. I think there was a time the country featured as to whether in Kenya, corona, is transmitted at night as opposed to during the day, and why exactly we had a curfew. And really, these are some of the things that are require country adaptation. We do firmly believe that the curfew intervention has aided in terms of, trying to slow down the disease and the progression. But the very nature of who we are as a people, in terms of how we socialize and in terms of how we engage, and particularly in night times where people may be, under the influence of alcohol and be less inhibited. When we look at the movement restrictions, perhaps this has been, one of the measures again that has contributed to the perception of COVID, and the stigma that is associated with. We have received numerous requests or, from different people on, them needing to move from one end of the country to another. And every time we're having these discussions, the different requests that come in, we ask them, have you put in mind, the risks, that you're putting in place in terms of, our elderly or your parents or your, the people who you love and care for, who you actually want to go visit. And I do remember some of these people saying, oh, really, then maybe I should call my mother, maybe I should find a mechanism. How do I really get in touch with my community? I haven't seen my mother for 3 months. And of course, this then affects, behavior change. It affects even adherence to some of these measures. And so it has been a really, really, should I say, interesting play and picture in terms of how all the different interventions have affected response and have affected adherence, and have really sort of, painted for us the fabric that comes into play when you're trying to put in place a measure and ensuring it is well effective. In terms of mental health, I think it became important, through this experience, what would the future look like, and what have been, should I say, the immediate quick wins when it comes to trying to curtail the stigma that is there. I must say, as government, in terms of our interventions, for the first time ever, we've really, hastened the recognition of psychologists and counselors in our schemes of service. And this might be, seem bureaucratic, and, perhaps those who are not in government might not understand this. But the idea is that for the first time, the country now recognizes the role that psychologists play, and putting, thought to pen and pen to paper. We are in the process of recruiting 134 psychologists, and this is happening through the Public Service Commission. We also have 50 clinical psychologists. Again, positions have been advertised, and all due to COVID-19. And so perhaps the silver lining in this is the idea that we've had to recognize as a society the importance of really protecting our mental health and how it is such part and parcel in terms of our response, how it's something that really has long been neglected when it comes to health, and how investments are needed in that space. In terms of our risk communication going forward, we are looking at, repurposing, how we actually communicate to Wananchi. We're looking at interventions that will see the Ministry of Health perhaps engage more with the citizenry as opposed to being, highly, circumscribed to the boardroom. Really, we've noted that there is power in being able to communicate what is happening. There is power in being able to actually use communication as a tool for behavior change. And so those are some of the changes that will be going on forward. And then, of course, through engagements with people like TIFA, and we had different other polling organizations and medical providers, we've really harnessed a lot of knowledge, which is very important, and curated it when it comes to perceptions. And this perhaps will inform even future interventions when it comes to, different policies at play. For example, the very nature of hand washing and the idea that I think, and maybe Maggie needs to run another poll, I think all Kenyans appreciate, hand washing, and perhaps this is now then going to be part and parcel of our behavior as a nation. And so really, again, the value of communication, the value of health promotion and health education. Again, like I said, an ode to the media who really played a role in terms of enhancing awareness. And really, again, trying to project what the future would be as a ministry and as government. We have noticed in health, perhaps there's need to refocus on what we'd call medical journalists, find a way how we have this continuous routine engagement with those specific medical journalists. And I'm sure you saw that we appreciated them through the Uzalendo Award. And then it becomes now necessary to, engage with them and sort of take them through, some of the technical nuances when it comes to healthcare, because we've seen, one, commendably a good job, but we've also seen some form of misrepresentation, and perhaps probably due to lack of understanding of the technical, aspects of this disease. Of course, then we've seen lots of issues when it comes to security personnel and enforcement of this, and I'm happy that the Ministry of Interior has taken cognizance of this. Just this week, the CES was able to receive a report from the Human Rights Commission in terms of their analysis of any, prejudices when it comes to human rights. And so again, happy to know that government now is really looking at this in terms of ensuring that we're safeguarding and protecting our citizenry, even as we put in place enforcement measures. In terms of resurgence, and maybe this is where, I would love to hear from the panelists and from yourself, Dr. Njenga, really, what the future would look like and what resurgence would look like in view of, the ill effects that COVID-19 has brought on to the country and to the world. What are the key learnings and how do we then move forward? And this here is an explanation as to the measures that we've put in place in government, but really recognizing that at the end of the day, it really is about each and every one of us playing a role and having a stake in it and actually actively participating in it. So a level of responsibility. And I like what Atwoli said in terms of being nice and just, trying to be good people. You can see that as a sector, in terms of, health sector recovery, community health strategy becomes extremely pivotal in terms of moving forward and ensuring that the community is part and parcel, one, of ensuring that they're there as we design these messages. And it would be interesting, working with people like Maggie and the teams on here and the media teams. How do we curate our messaging so that our messaging is understood by the populace? Today, I'm sure you all came across a meme that was going around, from some part in the country where someone was saying Corona is dangerous with a T, dangerous. I don't know if you've all seen that, but that's the community really participating in its awareness. And I found that, incredible and laudable in terms of, a shopkeeper putting up a sign, do not touch this surface, keep apart, Corona is dangerous. So really, as a Ministry of Health, we're looking at seeing how we can perhaps scale up our community health strategy approach going forward, touching on mental health, touching on stigma, anxiety, and other key elements in terms of allaying fears as government is then putting in place social safety nets. Yes, we're going through a tough time, as a global village and as a country. and villages and communities. So what do we need to do? And as government, we are working to ensure that we will put in place social safety nets when it comes to healthcare. Through the UHC scheme, we are predicting that we have close to 5 million households in Kenya who will not be able to afford healthcare. And so we're going to put in place measures to ensure that these households, are able to be protected, from this scourge and from the economic burden that comes with this scourge, to be able to access healthcare services. Again, ICT systems have been very useful. Maggie touched on social media. I feel perhaps part of my day is spent demystifying all the forwards and messages that I get in terms of what is happening here and there with regards to COVID. And so then there's an important element to perhaps be responsible, one as citizens, but also as, the people who are engaging in all these instruments, to ensure that you're not passing, fake news or false news, because it does drive anxieties in terms of people, being stigmatized, and it also affects people adhering to these interventions. Human resources become critical, as I've mentioned. We have now recognized our psychologists, and I think going forward, you will see a lot of investment when it comes to HR in terms of mental health. And then, of course, looking at our healthcare value chain. And, I'm happy to bring this here because this is actually Dr. Njenga's baby, and perhaps he might not be aware, but there's a lot of traction that has moved forward. Just last year, the president put together a mental health task force, and this task force, was tasked with trying to sort of have a more out-of-the-box feel in terms of what we need to do and invest in as government. And so having, reviewed their reports, I'm happy to say there's a lot of traction going forward in some of their recommendations. For example, going forward, you'll see, recognition of mental health in Kenya, perhaps setting up time to be able to actually discuss the issues as a community, as citizens, as a country, starting to sort of, spotlight this issue. A lot of issues that deal with mental health literacy, ensuring that there's a lot of financing, adequate financing for mental health services, ensuring that there's proper regulation for, health facilities that provide these services, of course, trainings for healthcare workers, but most importantly, adopting a multidisciplinary approach in ensuring that each and every member in society is actually playing a role to protect ourselves. And so this is my final slide, and perhaps for me, the truest testament in terms of the COVID-19 response and should I say the collaborative efforts of each and every partner, who has supported this. And the ones who are highlighted here are actually partners who've played a key role when it comes to trying to control stigma, trying to reduce stigma, and trying to really protect our healthcare workers and the citizenry. As you all are aware, Unilever has supported us a lot. AMREF has been involved in the training of psychologists, as well as Kenya Red Cross. We've had Absa Bank here actually put together a call center for healthcare personnel to ensure that they also have psychosocial support. And then, of course, all the other partners who are present and who are highlighted here, and others who could not be highlighted here today, have really put in, resources, time and energy to ensure that people are actually ensuring that mental health measures are taken into account in terms of the COVID-19 response. So thank you, Prof. That's sort of a quick amalgamation of what we're doing as government when it comes to stigma in coronavirus fight. Thank you.
Thank you very, very much, Mercy. I think you have answered very eloquently the question I had tried to trick Professor into answering, which is the role and centrality of government in all this. I have been asked before, and I've said it several times recently, that I'm happy and proud to be a Kenyan, because this kind of response really does give me confidence that at least in response to a pandemic of this nature, we have the right team doing the right thing. And as moderator, you can take that from me with grateful thanks for all the good work you're doing. We've been receiving very, very, very many questions from all over. There's one specific to Dr. Mwangangi. It says, Dr. Mercy, once our airports open, is the government planning to set up on-site testing for arriving passengers, or is it straight to quarantine as was happening before? Dr. Mwangangi, are you quarantining people or testing by the airport?
So thank you, Dr. Njanga. So right now we are reviewing protocols, and the good thing is this time around the protocols are being done together with the people who actually man the airports. There is consideration to actually have testing on site, but it's important to remember that for PCR testing, even if we take your sample, right now we do more or less require at least 2 to 6 hours by the time we get a positive response. So that would mean we would need to hold you somewhere. So as it stands right now, you still do have to get into mandatory quarantine when you do land internationally. And as the science evolves, as we get to the point where we can actually have that rapid test kit, test done and it's specific and it is sensitive, and of course we'd be able to test at the airport and then release you to either go home or to get into some form of quarantine.
Thank you very much. I think time is rapidly moving against us. We'll give Joe again one last chance to be heard. Otherwise, you'll have to wait until 10 p.m. tonight to hear him again.
I think it's unfortunate. I don't know what has happened, who has conspired to silence the media, but I think but I will not be gagged. Anyway, I think that one of the things I wanted to emphasize is engagement beyond the news, beyond the choreographed messaging that we have seen that targets people a lot more directly, to things that are more subtle. For example, we have seen many different campaigns around the world that depend on things like drama, where you go beyond the news and you infuse these things into dramas that are popular. Like, for example, in South Africa, we have something they call Sugar, Soul City. Those things have been used to send messaging that are that's really important in this. But the final thing I wanted to say is to really, and I think this would be to Dr. Mwangangi, about where the messaging ought to go right now, because the government has told us that this thing is going to be with us for a long time. Now, that's not a small thing. That means that we basically need to start adjusting our lives to find ways of coexisting with this virus, as long as there is no other intervention, for example, whether it's some effective treatment or whether it is a vaccine or whatever, it is something that will give people the comfort that, you know what, this thing can actually be conquered. So there's a sense in which, on the one hand, there is that messaging that this thing is really dangerous, but on the other hand, there is also this message that says, you know what, you brace yourselves, this thing could be here until next year, but one, nobody knows. So I think the place of personal responsibility becomes more important than anything else. How do we start to, how does a workplace look like in the presence of the pandemic? Because we can't close the country forever. That is a reality. If you look at the impacts that this thing has had on the economy, that conversation needs to happen. How do we move on? How do we live in spite of the fact that the virus is still potent, it is still out here? What do I do as a person? What do I do if I'm a shopkeeper somewhere? I don't think that this thing is dangerous is any longer the most appropriate information. So for me, it is there a way that the government can begin to shift its messaging, a place where, yes, we know this is happening. I mean, because today I was with someone who told me, you know what, if the president does not open this thing, I'll find a way of going to see my mother in Kitui. And I was looking at him and saying, like, wow, okay, that is interesting. He said he will find a way. And there are many people who are finding a way of going out there, not so much because they probably want to disobey what the government is saying, but because they are thinking, we have been told this thing is not going away, our lives are not going to stop.
Okay. So we'll take final remarks, 1 minute each. Maggie, you've been very involved in putting this whole thing together. What's your take message home? And would like to thank any particular group or persons in particular, Happy Place and people like that. Please do that now.
So just quickly, I just want to comment quickly on Dr. Mwangangi's presentation. I think it was very insightful. It's a piece of what we don't see on the daily briefings. So very comprehensive, and thank you very much for sharing that. And I'm hoping that at some point we'll get to know about what you call the home care protocols will be communicated at some point to the public. So thank you very much for that. But in terms of the webinar, what I feel is that there's been very good perspectives from everyone. And I think moving forward, I, as a researcher, actually have more information and more research questions that we probably need to provide data. And I'll just like, on behalf of my Happy Place, to thank everyone who's been part of this webinar, Joe Ageo and Dr. Lukoya, and also Dr. Frank. Thank you.
Lukoya, maybe you want to comment on Dr. Mwangangi's presentation and thank her and the usual things that you did very well.
No, thank you very much. I had absolutely no doubt that Mercy would do justice to the subject and present very clearly on what the government is doing, how it is doing it, and where we are headed with this pandemic. So Mercy has done a brilliant job. I think we need more of this, because while we might have some of this information, the general public often doesn't have a way of getting that kind of information in a simplified way so that they know if we are heading from Nairobi to Mombasa, where are we at the moment? How much further do we have to go? And do we still have enough fuel and so on? So I think that was a good way of doing it, and we can package it so that the message gets to the Mwananchi better. And of course, I want to thank my Happy Place for organizing this and Frank for moderating. And by way of finishing, I have two things to say. The first is that as far as stigma is concerned, I will repeat, if we all just strive to be nice to ourselves and nice to each other and to be good human beings, we will not have a discussion on stigma, because we will treat everybody as a human being. And if they have a problem, we will do the African thing and try and help them to solve that problem, rather than pointing at them and saying bad things about them and stigmatizing them.
Dr. Mwangangi, you speak for government.
Right. Thank you. Thank you.
Yeah.
Yes. So thank you, to the wonderful panel, for putting this together, for, providing this platform where we can discuss these issues. I was just doing a quick scroll through in terms of the chat section, and I could see lots and lots of questions about testing. And perhaps what I can say just in summary is that, one, the tests that we conduct are actual, figures, and we don't cook the figures. And I think it becomes important to really emphasize that, because I think there's association in terms of stigma and figures. I had someone ask me the other day, 200 cases, did you just manufacture them so that you could scare us more? And really, when you hear people asking you that question, it becomes important to really emphasize that these figures are not cooked. And like my friend always says, you cook something that you're going to eat. So we don't eat these figures. So really, this is the true case situation in terms of what is happening when it comes to the testing in terms of PCR testing. However, again, in the same light, it's important to note, because of our approach when it came to testing, and because of, the evolution of this disease, it becomes important for Kenyans to recognize that the disease has been with us, perhaps, as early as January, thereabouts. And so the true caseload of the disease might not actually be the 6,000 cases that we see. It might actually be more and more cases, way above that. And there are studies underway to determine what, the caseload would look like in terms of coronavirus, in terms of people who've been afflicted in the past and perhaps have developed some form of immunity. And why this important, fact is necessary for people to be aware of is because of what Joe has said, that truly, all countries are recognizing that we have to learn to live with it. And so, learning from Joe, there's need for us perhaps to then communicate. What does it mean to live, with coronavirus? And I think you do have my commitment that we will now perhaps focus on that element when it comes to communication. And I'm happy, Dr. Njenga, that you've brought us together, because I'll be leaning on this wonderful panel to push this forward in terms of how do you live with corona and how are we able to communicate that better. But then at the end of the day is to remind us of who we are as a people. And really, I don't say this, in matter of cliche, but Kenya is a resilient country. Kenyans are always able to bounce back. And so what we need to do is really galvanize ourselves, brace ourselves, but then continue on and move on with life. I do remember, some farmers asking me if they should plant. And that was quite a big question. The fact that perhaps people might have assumed that they did not need to continue, with farming practices. And you can imagine, therefore, the ill effects of that. So if you're not planting, it means right now we're dealing with corona, and perhaps we may then deal with other issues in terms of food security. And so what we will do going forward as government is perhaps communicate better in terms of what it means to live with this new normal, but to also remember that we are resilient. We are a resilient people. We are the people who are unlimited. And so we should live to that virtue. Thank you.
Okay, that's an excellent place to come to an end. I was asked recently what the silver lining of this horrible cloud of COVID-19 is for me. I have to say it's this panel here. I think this panel, and I'm talking now to the audience, has convinced you that our country is full of the human resources that are equal to the task that is before us. Every time I've gone into sessions of meetings that are intended to deal with this pandemic, I see emerging from places I did not know fellow Kenyans who are really very strong and able to stand their ground in any international forum. So I agree with Dr. Mwangangi that we are a resilient nation. We are a nation that will bounce back, and that will bounce back in a very big and strong way. And we are not just innocent bystanders. We as Kenyans can actually do something to mitigate the consequences of this pandemic. The audience has been very kind. They asked many, many questions, as we've been told. We haven't been able to answer all of them. The organizers will put all those questions together, and we'll see what is the best way of responding to all those questions. As we come to a close, allow me to thank Al Productions, who was behind the production of all this. Tifa Maggie, we cannot thank you enough for all you've done with your teams. And if it's left with me, I will try and put this team back together. Perhaps on a slightly different conversation, which is a look at what Dr. Mwangangi has ended with, which is what are the opportunities that are presented to us by this very dark cloud that is hanging over us. And there's also the question that was raised: how do we ensure that post-COVID we end up with a much more cohesive and secure society and community? Ladies and gentlemen, participants, and everybody else involved, I thank you as we come to the end of this very interesting and, for me, most informative webinar. Thank you and goodbye.
Thank you very much. Bye-bye.
Thank you.
Thank you, Kwaheri.
Asanteni sana.